And one of my dreams was to create a natural solution to provide women going through these conditions, right? Whether it's PCOS or endometriosis or just difficult periods.
Stress is so predominant and so prevalent that how are you able to ascertain, okay, this is due to this problem? It's pathologic stress instead of a general type of anxiety that people need to do to get the job done.
80% of women actually suffer from hormonal imbalance.
You know, when a male comes up and says, I need a female product for my girlfriend, they're thinking the girlfriend's crazy.
Yeah, that's a classic.
And she needs some help. She needs some real help.
And magnesium is a brilliant mineral when it comes to lowering your stress levels and that cortisol. Be happy for this moment. This moment is your life.
Hello, ladies and gentlemen. I'm Dr. Umer Khan. Today, I have an esteemed guest, Miss Ana Herrera. She is on a mission to improve hormonal health, specifically for ladies. And Ana, can you please introduce yourself? And she is the founder of Hormone Health.
Hi, thank you so much for having me, Umer. It's a pleasure to be in your show and to talk to every woman out there who is going through any issues with hormonal imbalance or hormonal health in general. I am the founder and CEO of Hormone University, which is a platform dedicated to educate and offer products to support and bring relief to women.
Excellent. So when I was talking to you earlier, it seems, and we got to a common conclusion, and of course, I knew this myself. Of course, I'm in healthcare and I practice as a physician, is that female issues are not given, a lot of time, not given that importance. It is labeled as this is all in your brain, it's anxiety, it's stress. I mean, stress can have a part in many ailments. However, a lot of aspects, specifically with regards to women's health, it's just brushed off as it's just you, it's just stress, anxiety, it's all in your head. Have you seen this? Is that a common theme that runs through the people that you talk to?
Yeah, absolutely. I have seen it. And I think what I want to start telling your audience is just a few stats that are real and they are something that is just happening. So 80% of women actually suffer from hormonal imbalance. So if you think about what every woman has to go through from the moment that she has she goes through puberty all the way to menopause, right? So then we've got female conditions that are very hard to diagnose still for some reason. So that's one of the frustrations that, as you mentioned right now, we're being told, women are being kind of dismissed or told, oh, that's nothing, that's your period, right? But 320 million women approximately are going through polycystic ovarian syndrome or endometriosis. So those are two conditions that are affecting more or less close to 15 to 20% of women for each of those conditions. And then you've got infertility and other issues that, we're talking like 1 in 4 couples are going through that. And then 75% of the symptoms that women go through during premenopause, menopause are pretty terrible and pretty tough to deal with. So, yeah, it is a very broad subject, hormonal health, and it affects us in so many different ways. And that's one of our roles, is to really educate and provide that information that women need to have.
No, that's definitely true. And the thought that comes to mind here is that it's very broad, it's very general. There are numerous hormones, and people normally think about estrogen and progesterone. But how many other hormones that you look to work on with regards to female health? And I'll let you talk a little bit about this, and so that people can relate to it if this is a problem that they could be facing.
Yeah. So, well, let's start with the fact that more or less everything we do is going to be governed by some hormone, right? So, and you're the doctor, Umer, so you know it much better than me. But we can start with something like cortisol, right? Stress is our is present in every day in our
I would
lives.
just want to interrupt a little bit. You mentioned that I'm a doctor and I know more than you, but I mean, I've never been in female shoes, although I've dealt with people.
That's
But
kind
is
to
that
say.
definitely you need to speak? You need to speak about it yourself.
Yes, thank you. That's very empathetic. Yeah, so starting with the hormone cortisol, which is a very interesting hormone that is under researched and very complex, and it affects us in so many different ways. So cortisol levels, if they go very high or very low, can have numerous side effects or effects in our everyday life. So there is this term called cortisol poisoning, which I've been looking into. And that's when, we go through stress, but we go through periods of stress that are kind of constant. So rather than having this, okay, you go through a little bit of stress, our kind of like everyday lives. But when you have prolonged periods of stress, your cortisol levels can really, really get very high. And that can create inflammation. So, inflammation is the foundation of many different issues, health issues. And therefore, just looking after that state of mind and making sure that we kind of manage our stress as best as we can, that can really help us to stop that inflammation process. So that's just one example. Of course, progesterone, estrogen, then we've got the happy hormones, right? We've got serotonin and we've got oxytocin, and there are just so many different hormones. Insulin is another one that we hear a lot about recently, in terms of how insulin levels can affect us women. So that's another one that, people just don't think about it, right? It's a hormone. Actually, vitamin D is a hormone. So there is just a lot of information and knowledge that we all need to learn about.
Uh, you mentioned vitamin D is a hormone, definitely, and in textbooks, it's listed under vitamins, but it definitely works like a hormone, and it regulates and helps regulate so many other hormones, parathyroid hormones, for example. But anyways, you talked about cortisol and stress. So it's difficult to sometimes quantify. Maybe since you work with these individuals, ladies, much more closely possibly than I ever did. Um, so stress is so predominant and so prevalent that how are you able to ascertain, okay, this is due to this problem? It's pathologic stress instead of a general type of anxiety that people need to do to get the job done. How do you go about figuring out, okay, this lady, this woman, or it could be anybody for that matter, has the stress that really needs to be dealt with and helped out with some of the products that you have?
Yeah, so we don't assess, right? That's not our role. And I would, of course, tell every woman out there that if they feel they're going through stress, like I think our body tells us, and we know, right? Depending on what's going on in our lives at that precise moment. Um, I personally just had a pretty stressful situation yesterday, right? I had some difficult news, and so I can feel that tension, and I can feel that I am not calm. So that you need to first of all listen to your body. So at Hormone University, what we do is we provide information because we believe that we need to learn about these topics, and effectively we provide products. So we created a product called magnesium and collagen lotion, which is just behind me here, because what we find is that after doing a lot of research is that magnesium, first of all, most people are deficient in magnesium, and magnesium is a brilliant mineral when it comes to lowering your stress levels and that cortisol and the cortisol levels. So apart from many other great benefits that magnesium has, and it calms you down. So it's great for anxiety, it's great for stress, and it's great for sleep. And so we need to also add other components here. Like, are you sleeping well? If you're not sleeping well, you might feel that you are more tense, or you are more stressed, and you feel like you want to eat more, right? So you sleep a little, you sleep maybe less than normal, You wake up, you're not feeling great, you feel like you're hungry because that kind of triggers certain hormones as well, and it makes you hungry, right? And you might want to start eating sugar because that's kind of like an easy way to get yourself a little bit filled. So everything has almost like a knock-on effect on other things. And so what we did was create products, and this came all from my own personal story with hormonal imbalance, to help women no matter where they are in life. So whether they are going through premenstrual syndrome and all the ramifications of premenstrual syndrome, all the way to menopause, and stress and sleep is one category that we wanted to tackle.
No, so definitely that's important, because something like this, since this is something that people put down and they say, okay, this is not that important. And you mentioned you had a personal journey with this, and that motivated you to get into this field and work on this and look to help other women who may not be considered, okay, this is a real medical issue, or this is a problem that needs to be dealt with. Are you okay in talking about it? What was it that really caused you to take on this journey?
Yes, thank you for asking. I am okay talking about it. I wasn't okay talking about it, which was a massive mistake that I made for years and years and years. I was silent, like so many women are, and I did go through. I was basically diagnosed with stage 4 endometriosis in my mid-20s, and like I said, it's a condition that affects almost 20% of women. It's a condition that is a chronic condition, in fact, that is totally under-researched, and that one of the key symptoms is excruciating pain. It's basically, just to describe what it is, it's a tissue similar to the lining of the uterus that gets infiltrated in other organs. So the most common organs are usually ovaries, and then other reproductive organs. Now, endometriosis has this very interesting and kind of unknown effect. It kind of acts like cancer. So it can infiltrate in any other organ in your body. So it can actually go to your eyes, it can go to your skin. There has been instances of being infiltrated in the lungs. So it kind of travels to a different organ. It's a very strange condition and dynamic. And like I said, not well researched at all. So I was diagnosed straight away. By the way, it takes around 7 years on average to get this condition diagnosed.
And I'm just want to interrupt for a second. What are the main reasons why it takes so long?
Yes,
Maybe you
great
have an
question.
interesting point on this. I don't want to say it myself, but a couple of reasons why.
Yeah. Yes, I'm glad you brought that up. So one of the main reasons is because, excuse me, as you said at the beginning, women are being dismissed, right? You come to the doctor or you go to your GP and you're like, oh my gosh, my periods are unbearable, absolutely unbearable. And then you're being told, well, that's normal, just take a painkiller. But in fact, it's not normal. And I want to say this to every woman listening to your show, Umer. It's not normal to have very, very, very strong periods and painful periods. So I was one of the lucky ones. I got diagnosed straight away. And my doctor knew with an ultrasound. And he sat down with me and explained to me, okay, this is what you're going through. And this is going to be a very tough path because there is no other way but surgery or painkillers or hormonal treatment. So this path effectively was very tough, and it took over 10 years of excruciating pain. I was in pain for 50% of my time. So you can just imagine, multiply that by number of years. It's pretty awful. I had to go through 5 different surgeries, and I had other ramifications like infertility. So again, let's not assume anything when people don't have kids. You just never know if they've had some sort of health condition. And I also had to go through surgical menopause. So that means that you're put into surgery and they have to kind of take your reproductive organs out of your system, like completely out of your system. So you, by de facto, go into surgical menopause straight away, which is a shock, right? A shock to your body.
Yeah, no, definitely. And one more aspect is that the symptoms with endometriosis, they largely present or are more pronounced when you have your regular, with your cycle.
Right,
And
correct.
that makes it, that masks the symptoms a bit more in a lot of patients. And
Yes.
that is another reason why, okay, the lady will come to the gynecologist office or anywhere else, or the primary care physician, and they'll talk about it. They'll give you some Motrin or a leave to calm the pain down, but you will think it's fine, it's normal. I just have it bad. And people really suffer until
Yes.
something happens. So you get imaging done, or something else happens that for some other reason it's picked up. So yeah, and it's a sort of a perfect storm in a way for a lot of people who may think it's something that they don't need to worry about, and just need to just go get over it and move on with life. It's something just they have to live with. So that's is that similar? A lot of have a lot of people explain a similar scenario to what you've described in your experience when you started the Hormone University?
Yeah, so many women write to us, and I really I get personally involved, and I have interviewed customers, and I've asked them about what they're going through. And one of my dream was to create a natural solution to provide women going through these conditions, right? Whether it's PCOS or endometriosis, or just difficult periods. And yeah, that's exactly what they're saying. It's just, they're not being diagnosed on time, or they're being told that it's just, sometimes, oh, it's going to pass and it's going to be okay, and they're not okay. So it is a tough one.
And I remember a recent patient that I had, a young woman in her 20s, and I was seeing her for a different purpose, and her hemoglobin was around 7. And I looked back in her chart, look at the records, and I saw it's been low, and hemoglobin is supposed to be more than 12, 13, right? So it's been low. And I said, what is happening? She said, yeah, I bleed a lot. I said, that's not normal that you bleed that much and you're not getting checked up, and you're not getting addressed properly. And I saw that she was being seen in clinic, and people are documenting it, but it's not being addressed. It's not supposed to be like this. You're not supposed to have so much pain. She was having significant pain as well with her periods. I said, okay, definitely it's something that needs to be looked at, and not to be just brushed aside and, okay, move on. Okay, this is your life. So um,
Yes.
one question. So, and a lot of the medical people will ask that everybody is, of course, for natural medicine, and have not having needing to take medication as much as possible. But in your experience, and what you have experienced with this, and the products that you have, uh, how do you know how much and what works, and to what extent it will work, and how are you able to gauge all of this?
Yes. Well, of course, we did studies before we launched, right? So I did not want to launch a product line that would have no evidence. And we have a couple of important points here. One is the studies. So before we launched, we did a study with women going through premenstrual syndrome, and half of them were going through. So the entire cohort was 100 women. 50 of them were going through premenstrual syndrome, pretty strong symptoms, and the remaining 50 were going through menopause. So we asked them to try our formulation completely blind. They didn't know what it was. And there was an app that was created for them to kind of record their symptoms, and it was pretty outstanding. So after just 30 days, there was a significant improvement in their symptom relief. So that's what, of course, triggered the wow, this is great, this is working. We had done a lot of research beforehand. I was very lucky. I had a team of alumni from Columbia University, and we have a great doctor with us as well, so, and a pharmacologist. And so, yeah, it was a very, very long process. It was actually a 2-year process, and around 20 different variations of formulation before we got to the right one. Then the studies, and and then finally we've sold like thousands of product now, and women are telling us, I mean, I've had women cry, and I cry too. I get very emotional when they tell me how their lives have changed. And it's just been, it's very hard to create a company from zero, and it's my daily purpose, and it's the most fulfilling thing I've ever done.
No, exactly. It was a personal experience that led you to start this. And
Yes.
the greatest benefit is, and in a way, you are a clinician. What we see in the hospital or a clinic, wherever, that you are actually making a difference. You are actually improving their life. And from your part, it's many of those things that are not easily treated. And they are just brushed aside as something psychological or something that they have to go through. And you've been going through this for thousands of years, and it doesn't really matter now because females have been going through the thousands of years. And you have to live with this. And when you come to a realization, no, it's you can tailor things, and you can identify specific needs, and you can fix things. And if it's getting results, this is usually ends up to be a driving force. But having
Yes.
said this, it's the driving force, and it's a personal experience. Was it easy? You with your startup going through this different phases of you struggling, succeeding. How did you keep yourself motivated? Because one would think that, okay, how am I going to find something that will actually work when there's so many obstacles, mental as well as practical obstacles to any of this.
Yes, it is really tough. Nothing can prepare you to start your own company. And I have, significant corporate background, and I've worked with very, very well-known brands. And I've done very well in my career. I've worked very hard despite stage 4 endometriosis, but nothing can really prepare you to what it's like to start a company from zero, and especially in this particular category that doesn't really exist and people don't talk about. So there is a lot of education that you need to do to let people know what we're doing and how we're doing it. So we're not a drug company. We don't have the budgets of one of those large companies. So it is really hard. And how do I keep myself motivated? Honestly, it's my mission. I mean, it's hard to explain. It's something that I have this sense of injustice almost daily in how us women have been, let's say, forgotten. You've got Viagra in the market, but the market also gives us the contraceptive pill, which has major, major, major consequences. And I'm not going to tell people what to do with their lives, and this is a whole other subject. But I do think that it is really important that whoever is launching a company in women's health, that we have that experience, personal experience, that no company in the world can have, right? Because it's just not the same. So I like to engage with our customers, and I keep myself motivated, and especially when I talk to them, it's like a massive boost to really keep going. It gives me a lot of strength.
So the next question in the same line, and as a female, so you have an idea, you have a thought, and maybe you can put your mentor hat on, and it's to do with female issues, right? And how do you go about actually taking the next step if somebody out there is a female and they've experienced certain issues and they think that they know a way to possibly work on this and solve this problem, but they don't have the funding, they don't have a tech team, perhaps they don't know where to go, and the biggest problem that will come to them is they're going to talk to men possibly, and the man will not understand what she is saying. And did you have this hurdle? And if yes, how did you overcome this hurdle? I'm pretty sure you had to talk to men who may not have understood what you're talking about.
Oh my God, totally. Yes. Um, yes, of course I came across that.
Imagine.
Yes. And I want to say to every woman out there or anyone out there, I mean, it could be a man going through a hormonal health issue, right? Look, it's starting a company is like learning a new language. At least that's the way it was for me. It was really hard. It's like, what is this terminology? And even though, like I said, I had very strong corporate experience. So what I would say is this. I'm proud that I took a long time to make sure that our product worked. It felt never ending because it's a long time. And of course, you put in your time, your resources. I put my own savings. And so there is that kind of initial process whereby you're researching and you're making sure that your idea makes sense. And it's what it's called like, product market fit makes sense. So I started like literally drawing on a piece of paper. Like these are I did a research on symptoms. I'm like, oh my God, women go through over 150 symptoms. And at the moment, they have two options. One, they can take the hormonal route, right? So they can just go and get a treatment, a hormonal treatment, whether it's the pill or HRT, which is hormonal replacement therapy. And that's fine, right? But I couldn't take hormones. So, and there are a lot of women that don't want to take hormones. So there is that option. And then the second option was painkillers, right? So those are my two biggest competitors. And I could not find anything that was clinically validated, evidence-based, but it was natural. And I would have the certainty that would have no side effects on me. So I just, by doing my research, I understood very clearly that there was a massive gap in the market. So that's the first thing you need to do. Is like, is there a need? First is like this, there is a problem. Can you create the solution? And then based on that, what is your market, right? Like how many people can buy your product and what other competitors are there that might create an impediment to your product in the market. And then of course you've got funding, and I talk to people, they help me out, and I raise some capital, because otherwise it's like impossible, especially in the US. It's so hard.
And exactly, and specifically talking about getting these type of messages across. And you mentioned a very obvious, not an obvious thing, but a lot of people miss out on this, especially the first-time founders or startup founders, is that they don't realize it's a stepwise process. You just can't have an idea. You need to really work on that idea. You need to refine your idea. And first thing, you have to try to get your idea out to the market as soon as possible in a way that's the minimum viable product that you feel actually solves an issue for a small particular population or small particular problem. And going through this process, there's numerous steps involved that you just talked about. One is, finding product market fit. You may not find it at the first iteration of the product, but that's sometimes could be an ongoing project. But in your line of things, you wanted to make sure that it works. Specifically, it may work for you or the people who are next to you or your family members that can potentially try the product. And then, of course, you have to see, how to market this, how to get money for this, how to promote this, building pitch decks. Everything goes into this to actually get something out there. And of course, you mentioned that you have to do, research. You have to see if there's any competitors, what's already out there. A lot of times it happens. I was talking to a person. He said, "Hey, let me make an application that will split the bill when you go to a restaurant." I was talking to that person. I said, "There's already an application out there." So you have to do your research. You don't want to waste your time if something's already out there, multiple fold, and you spend all your time and money and nothing gets done. So just talking about this a little bit more, is your team female based or they're also male involved? How is it, and how difficult was it to potentially get any male member on board?
Okay, yeah. So my my team is all female, I'm afraid.
I think
So
that answers my question.
yeah, that
The
answers your
second
question.
question you have to answer then.
But honestly, I think it's just been, it's just the nature of my business, right? That attracts it just attracts women, and they get so excited when we interview people, and they're like, oh my god, and this happened to me. I love what you're doing. I want to work for your company. So it's just a very personal thing. And we do have male advisors, and we do have couple of freelancers that we work with that are male. And it just takes a little longer for them to kind of understand, unless someone in their immediate network has gone through something like this. So it might be their wife, or it might be their sister, or someone. So then they're like, okay, I get it, right? My girlfriend is going through this. Okay, I get it. I love what you guys are doing, and I need a product for my girlfriend, kind of thing.
Right.
So yeah.
When a male comes up and says, I need a female product for my girlfriend, they're thinking the girlfriend's crazy.
Yeah, that's a
And
classic.
she needs some help. She needs some real help. But to
Yeah.
step back a little, so you mentioned a couple of products that you worked on, and a couple of ailments, premenstrual, endometriosis. What other disease lines or product lines have you worked on, and that you can surely say that these are, you definitely offer some help with this?
Sorry, can you repeat the question?
Yeah. So we talked about two conditions, so premenstrual issues as well as endometriosis.
Hmm.
What other conditions have you worked on, or
Yes.
that you have products related to, that you feel definitely
Yes.
would benefit people?
So yeah, this is our period SOS. You can see it very clearly, right? So period SOS is the product that will help with anything that's related to your period. So, and by the way, I very proudly have a personal note to anyone buying the product. It's in the packaging. And what this cream does, and by the way, very different approach. So we don't have oral supplements. It doesn't mean we won't do them, but I decided to create a topical approach, so a transdermal approach. So what you do is you apply this you put it in your abdomen, inner thighs, and you use it daily, and it will help with things like bloating, heavy periods, irregular periods. We've seen also an increase in libido. We've seen, of course, pain and cramps is really quite amazing. We just had also someone sending us a picture of a before and after. They had major bloating, and literally in hours, the bloating was gone. I'm not saying this is going to be for everyone and this is going to work perfectly for everyone, but we've got significant results. So it helps with period symptoms, endometriosis symptoms, and polycystic ovarian syndrome symptoms. So anything that has to do with your period. And those two conditions, we actually had two further studies, one with women with endometriosis, one with women with PCOS. And yeah, it works extremely well.
How about menopausal symptoms?
Yeah, we have another product. So this one is period SOS, and we have the same one for menopause. So that's called menopause SOS. Excuse me. And this is the one. So it's again similar approach. It's topical. You just put it in your tummy, inner thighs. You have to use it daily. You have to be consistent. Think about this as a supplement, but it's topical. And you can also use it, by the way, in this area, like your inner arm, and it just goes straight to your bloodstream, and it works extremely well with all the classic symptoms that menopausal women go through, or premenopausal. So it's like night sweats and hot flashes and changes in mood. So what this does is very basic. It just balances, it really helps stimulate estrogen and progesterone. And so it really calms down all of those symptoms. That's why it's a multi-symptom approach.
Okay. And how about, do you have anything for patients, people who are in there, after the menopause? A lot of people go on,
Postmenopausal.
postmenopausal and go on hormone replacement therapies. What were your thoughts on that, and have you explored that in any bit?
We've got women that have tried menopause SOS that are postmenopausal and they love it. They absolutely love it. So we haven't done a study with postmenopausal women, but we do have customers that really feel a difference in many things, in many kind of different symptoms. So mostly they complain because they have no more libido, and that's the one thing that is working for them.
Okay, great. And so, how do people get in? You have a website and you have a questionnaire that people go through. And what should people expect when they go to your website? And maybe you can mention your website as well. And so,
Of
people who are
course.
interested, they can venture and see if this is something for them.
Yeah, absolutely. It's hormoneuniversity.com. And yes, we created a symptom checker that is very thorough and detailed. It's something that it took us a while to create, and the result was great because you can do it in 5 to 7 minutes, and it will just tell you if you're going through hormonal imbalance, depending on how you answer the question. So highly recommend that you go through the symptom checker. We actually did it in conjunction with our OBGYN. She's our chief medical officer. And she loved it so much that she uses it in her practice. So it's a very, very kind of detailed questionnaire, and it would just tell you straight away if you've got hormonal imbalance or not. So that's the first thing that you can do. Then you get your results via email, and you can go to our Glow area and Glow, our product area, and you can just shop for these products there.
So, you are collecting symptoms. There is a bit of aspect of tech involved, and you're sending an email out. Are these patients? Are you working in collaboration with the gynecologist and you as well, or how does that happen with their regular gynecologist and their regular care that they may be receiving?
So yeah, we do not provide gynecological, let's say, consultations. They would get their results via email, and then they would get recommendations of product and content as well. So, if we see that a woman is going through menopause and has really strong hormone imbalance, she's going to get some pieces of content that are going to help her understand, okay, so this is like, for example, this is a specific diet protocol that they should follow, right? If they're going through menopausal symptoms. So that's just one example. And then, obviously try our menopause SOS. Maybe she can try the magnesium lotion for like calming and if she's anxious. So yeah, there are many different ways that we can recommend different things that could be great for her.
Okay. So there is a way you can go on their website, hormoneuniversity.com. Is that it? Hormoneuniversity.com?
Yes.
Okay. Website, there is a questionnaire, a symptom checker that will walk you through and and you will receive an email at the end, and you can see what's suitable for you at that point. So what is your future plan for this? How are you reaching out to the public, the market, because there's a huge need for it? How are you going about this? Because that's the next step, and marketing is the next step for any product to get out there.
Yeah, absolutely. I mean, we do, of course, there are so many different things that we're doing. And one of them is what we're doing right now, you and I. And I really want to thank you for having me here, because it's really thanks to also the people that have this wonderful podcast that we can spread the word. And so that's
an important thing. It's an important topic to talk about. Yes.
Yeah, very important. So I do go on podcasts all the time. I also talk I talk for companies. Like I've done talks for large companies like Snapchat and several banks. And I just talk about the importance of understanding your hormonal health. We, of course, do other collaborations. We talk to influencers. We have a great following of experts and key opinion leaders that also spread the word for us. And we also invest in, of course, Facebook ads and Google ads, like any other company at this stage.
Oh, great. So what basic self-care advices would you want to give to female, regardless of what their symptoms are? Anything in general that you would recommend, given that you are in the hormone space, about
Yes.
how to live their daily life? Would be your take?
Yeah. So what I usually say to women is that they should, first of all, knowledge is everything. Knowledge is the foundation of everything. So first, listen to your body. Don't dismiss any symptoms that you might have. Also, read, and read. Like, inform yourself and have that ammunition with yourself. So if you go to the doctor and you think that there is something wrong, you can also ask the right questions, right? So our newsletter, by the way, is called The Waiting Room, because I always thought, when we're sitting in that waiting room, we need to have that ammunition. What are the questions that I need to ask? This is going on with me. So that's really an important piece of advice. Then the second one is try to really put yourself first. I think as women, we tend to think about others and put them before us. And so it is important that we manage, like we said, our stress levels, that we look after our diet, extremely important when it comes to hormonal health. So trying to avoid things like alcohol and sugar and other things that can create inflammation in our bodies. Exercise, really important. Get rid of those toxins and really help the kind of happy hormones. So you get great hormones coming out when we exercise, and it's really important. Sleep is another thing that I tell people all the time. Like, don't feel guilty. Like, you have to feel rested. And the older we get, the more important it is. So yeah, that's also a crucial thing that we need to take into consideration, because when we get older, we actually want to sleep less. It's when you're a baby, right, you sleep so much more. And so it is important that in this day and age, with so much stress, that we give our body the rest that it needs. And and also, like, I'm not someone, I feel that balance is key in life. So nothing in extreme, listen to your body. Really, food is medicine. That's very, very important. So it is crucial that we eat well for hormonal balance.
Excellent, Anna. So I think we should wrap it up. You've gone through a lot of different aspects of hormonal health, especially for females, and what you're doing and how you're looking to help ladies out. But before we finish, I'm going to have a few rapid fire questions. Are you ready for that?
Let's do it.
All right. Excellent. So how much are you expected to make in 2023?
Whoa, what do you mean?
If you're okay and you expect, what do you feel? How much do you think you'll be, making in 2023 with this endeavor, with this startup?
I think I want to get to sell around 15 to 20,000 units, but I'm not going to reveal revenue.
That's fine. How much do you expect to sell? How many units you're expected to sell in 2024 when you scale things up?
We want to grow at least 3 times.
Great.
So,
okay.
Yeah.
All right. And in one line, what is the problem that you're looking to solve?
I want women to take control of their hormonal health.
Great. And what would you be doing if you were not doing this right now?
Probably helping another startup in the hormonal health space.
Okay, that's fair enough. This is what your field is. So, what is the most helpful quote or phrase that you would want to share with the audience?
Be happy for this moment. This moment is your life.
Absolutely. The last interview, the last interview that I had with somebody, that was it. That was the same piece of advice. So, if there's one book that you want people to read, what is that book? Which is that book, and why?
Gosh, there are so many books that I love. It's very, very hard. It really depends whether it's a book for business but there is one book that comes to mind that I usually tell people about. It's called The Growth Mindset. And that's by Carol Dweck, I think, if I'm pronouncing her last name correctly. She's a psychologist, and that's a brilliant book that can be applied to business and to life. It's how you position things and how you think about growth in different aspects of life.
Excellent. I actually haven't read this book, so I'm gonna definitely put this on my list. You definitely intrigued me. Last question: where can people find you, Ana?
Yes. So you can find me on LinkedIn at Ana G. Herrera. You can also find me on my own Instagram account. I have a personal one. Feel free to follow me, Ana G. Herrera, as well. And otherwise, you can write to us at Hormone University and follow us on Instagram at Hormone University.
Excellent. Thank you so much, Ana, for your time. And I'm pretty sure a lot of people are going to be benefiting, and hopefully they can reach out to you in case they need any help. Thank you so much. Talk to you guys
Thank you
soon.
so much for having me. Thank you.
Thank you. Bye-bye. I appreciate you as a valuable viewer, and thanks for watching till the very end. If you liked this, check out this podcast. I know you will love it. You can also check for more interesting links in the description. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.